A horse suddenly begins drooling, eating slowly, and dropping feed from its mouth. At first, it may look like a dental problem, a minor scrape, or perhaps something irritating the inside of the mouth. But when painful blisters begin appearing on the lips or tongue, that seemingly small change could be the first warning sign of a reportable disease capable of placing an entire property under quarantine. That is now a concern for horse owners in the Southwest, as vesicular stomatitis continues to appear on equine properties in Colorado and New Mexico. New cases have recently been identified in southwestern Colorado. And because this virus can be carried by biting insects, preventing its spread is not as simple as keeping unfamiliar horses apart. So, what exactly is vesicular stomatitis? How can a biting insect expose a horse that has never left its property? And which early signs should owners recognize before the virus has an opportunity to spread? Today, we are looking at the continuing vesicular stomatitis outbreak, what the newest USDA report tells us, and the practical steps horse owners can take to protect their barns. The Colorado Horse Forum recently reported new confirmed cases on equine properties in Archuleta and La Plata counties. A few days later, the USDA reported 2 additional presumptive positive properties in Archuleta and Montezuma counties. As of July 24th, Colorado has 6 affected equine properties across Archuleta, La Plata, Montezuma, and Montrose counties. The larger outbreak included 37 affected properties across Arizona, Colorado, and New Mexico. These figures represent affected properties rather than individual horses. So far, only equine species have shown clinical disease during this outbreak, and all laboratory-confirmed cases have involved the New Jersey serotype of vesicular stomatitis virus. Although all affected properties in Arizona have now been released from quarantine, new cases were still appearing in Colorado during late July. That continuing movement is particularly important because vesicular stomatitis is not spread in exactly the same way as many other equine diseases. When we hear about a contagious disease, we may immediately think about horses touching noses, sharing buckets, or standing close together inside a trailer. Those things can still contribute to the spread of VSV, but biting insects are believed to play a major role in moving the virus between animals and properties. Black flies, sandflies, and biting midges are known to transmit the virus. Other insects may also contribute to its spread. Vesicular stomatitis virus circulates regularly between livestock and insect populations in southern Mexico. It only occasionally moves north into the United States when environmental conditions support the movement and survival of infected insects. This is why outbreaks are often associated with warmer weather and why new cases may appear in horses with no obvious history of direct contact with an infected animal. A horse does not necessarily need to attend a show, share a trailer, or touch noses with an unfamiliar horse to be exposed. Once infected, a horse may initially show signs that are easy to mistake for a much more ordinary problem. Excessive drooling is one of the most recognizable signs. A normally enthusiastic eater may begin chewing slowly, dropping feed, resisting the bit, or refusing harder feeds because using its mouth has become painful. When the lips are lifted, an owner may find blisters, ulcers, or raw areas in the lips, gums, tongue, muzzle, or elsewhere inside the mouth. Blisters may rupture before they are noticed, leaving behind red, painful erosions that can look like scrapes or burns. Crusting or lesions may also develop around the nostrils or inside the ears. In some horses, sores appear in the sheath or udder. The virus can also cause lesions around the coronary band immediately above the hoof. These lesions may be painful enough to make the horse lame or reluctant to walk. If an owner focuses only on the horse's mouth, this connection between the sudden lameness and the disease may be missed. Not every affected horse will develop all of these symptoms. The severity can vary considerably, and some of the signs can resemble many other conditions. A horse may injure its mouth on a sharp object, develop irritation from a plant, experience a dental problem, or react to a chemical substance. None of those possibilities can be reliably distinguished from vesicular stomatitis through a social media photograph. The appropriate response is not to panic, but is also not to wait several days and hope the problem disappears. If a horse develops unexplained drooling, difficulty eating, suspicious mouth sores, or sudden lameness accompanied by lesions around the coronary bands, contact your veterinarian before moving that horse anywhere. Do not load the horse into a trailer and drive to a veterinary clinic without calling first. Do not take the horse to a show, boarding stable, breeding facility, or another barn. If vesicular stomatitis is suspected, moving the horse could expose additional animals and complicate efforts to contain the disease. Vesicular stomatitis is reportable because its lesions can resemble those produced by more serious foreign animal diseases. One of the most important examples is foot and mouth disease. Horses are not susceptible to foot and mouth disease, but cattle, pigs, sheep, and goats are. Because both diseases may produce similar blister-like lesions in susceptible livestock, animal health officials must quickly determine which disease is involved. A visual examination cannot provide that certainty. Veterinarians work with state and federal animal health officials to collect appropriate samples and coordinate laboratory testing. A laboratory-confirmed property has met the official case definition through testing. Once a county has a confirmed case, however, officials may not require the same laboratory confirmation for every additional horse showing compatible signs in that county. Those properties may instead be classified as presumptive positive and quarantined as part of the outbreak response. The term presumptive positive does not mean that a case is merely an online rumor or an owner's unverified guess. It is an official classification based on the horse's signs, location, outbreak history, and the criteria used by animal health authorities. When a property is confirmed or classified as presumptive positive, susceptible animals may be placed under quarantine. According to the USDA, affected properties are quarantined for at least 14 days from the onset of lesions in the last affected animal. That detail can significantly affect how long a quarantine lasts. If one horse develops lesions and another horse on the same property becomes affected several days later, the timeline may be extended based on the second horse's lesion onset date. The property is not automatically released simply because the first horse is improved. Quarantine is intended to limit movement while affected animals recover and to prevent horses or contaminated equipment from carrying the virus to another location. Although a quarantine can disrupt lessons, training, breeding, etc., it is one of the tools officials use to contain an outbreak. Because insects are involved in transmission, controlling movement alone cannot eliminate every risk. Horse owners also need to reduce insect exposure while strengthening their normal biosecurity practices. Fly sprays and other insect control products should be used according to their labels. Physical barriers such as fly masks and fly sheets may provide additional protection when they are appropriate and safe for the individual horse. Manure and wet organic material should be managed regularly. Leaking water should be repaired, and unnecessary standing water should be removed. Fans may help it by making it more difficult for small flying insects to land on horses. However, horse owners should have realistic expectations. Some biting insects breed near streams, irrigation areas, wet soil, and decaying vegetation. On farms where irrigation is necessary for maintaining pastures, eliminating every source of moisture is neither possible nor practical. The goal is to reduce avoidable insect habitat, limit the number of insects reaching the horses, and combine those measures with careful daily monitoring. Do not simply look into the pasture and confirm that every horse is standing. Watch each horse eat. Notice whether a horse is chewing differently, dropping feed, drinking less, or producing more saliva than normal. Look for swelling or crusting around the mouth, nostrils, ears, coronary bands, sheath, and udder. Pay attention to sudden lameness that does not have an obvious explanation. This is especially important in a large barn where several people may share responsibility for feeding and caring for horses. A small change noticed by one person can easily be overlooked if that information is not communicated to everyone else. Newly arriving horses should be separated from the resident population for an appropriate period determined by your veterinarian. They should have their own water buckets, feeders, grooming supplies, and handling equipment. At shows and clinics, bring your own buckets and avoid communal water sources. Do not share bits, bridles, halter, lead ropes, etc. If a horse begins showing suspicious signs, separate it from the other horses as safely as possible and call your veterinarian. Handle the healthy horses first and potentially affected horses last. Do not carry buckets, lead ropes, grooming tools, or other supplies back and forth between the isolated horse and the rest of the barn. Wear gloves if you must handle the horse's mouth, examine lesions, or come into contact with saliva. Wash your hands thoroughly afterward and change contaminated clothing before handling other animals. These precautions help protect other horses, but they also help protect people. Vesicular stomatitis is considered zoonotic, which means people can occasionally become infected. Human cases are uncommon and are generally associated with direct exposure to infected animals, saliva, lesion material, or the virus in a laboratory setting. When people do become infected, the illness may resemble influenza. Symptoms can include fever, headache, muscle aches, and fatigue. This does not mean owners should be afraid to care for an infected horse. It means gloves, hand washing, clean clothing, and avoiding direct contact with saliva and open lesions should be treated as necessary precautions rather than optional ones. There is currently no specific antiviral cure for vesicular stomitis, and there is no routinely available vaccine for horses in the United States. Veterinary care is focused on keeping the horse comfortable, maintaining nutrition and hydration, and preventing complications while the horse's immune system clears the infection. Because mouth lesions can make chewing extremely painful, affected horses may need softer or soaked feed. Pain relief and anti inflammatory medication may be recommended by the attending veterinarian. Secondary bacterial infections may require additional treatment. Horse owners should not apply random chemicals, caustic substances, or unapproved home remedies to the lesions. Products that irritate damaged tissue may increase the horse's pain and delay healing. Most horses recover, but recovery may take several weeks, even if the disease is rarely fatal in horses. That does not make it harmless. The lesions can be extremely painful. Affected horses may struggle to eat, and the consequences of quarantine may extend to every animal and person on the property. Owners planning to travel should also remember the disease related entry requirements can change. A destination state, showground, veterinary hospital, or boarding facility may establish additional requirements for having horses from an infected area. Before leaving home, contact your veterinarian, review the destination state's current animal entry requirements, and speak with event management. Do not rely on a social media post or health alert published several weeks earlier, because the situation may have changed. There is reassuring news with the current news reports. Every affected property in Arizona has been released from quarantine, and previously affected properties in Colorado and New Mexico have also completed their quarantine requirements. Horses can recover, and individual outbreaks can be contained. At the same time, the appearance of new presumptive positive properties in Colorado tells us that the larger outbreak is not over. Horse owners do not need to assume that every mouth sore or drooling horse has vesicular stomatitis. They do need to recognize that these signs require prompt veterinary attention, particularly in or near an affected region. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing.